Also, Eastside is building trust in the community. It's one of the utmost important things that they're doing. All of these talented individuals, they're thinking, I like to say that they're thinking beyond. They're thinking beyond their current circumstances. They're thinking beyond the current administration and beyond the current numbers that are in health inequities right now. They're impacting the people that we love. We're not just business people in here. We've also got families. I met some people in here. We've got a pregnant person in here, other people that are going through health challenges. We've got regular, everyday people here as well that are represented. And the stories here are represented of the families and many, many, many stories that are coming out from this room here. With that, we're making a slight change to the program to talk about more stories. So we're introducing our next panel, which is Love Your Skin and HStory. So I'd like to welcome our panelists. Come on right up. Love Your Skin and HStory.
You guys go ahead and take chairs. I'll stand.
Thank you.
Yes, of course. Good morning. All right. Thank you guys for joining us this morning. My name is Jade Curtis. I am the executive editor of blackdoctor.org. Uh-oh. Looks like I do get a chair.
Okay, here, we'll swap. Here. Sounds good. Thank you. Can we swap?
Oh, yeah.
Thank you.
All right.
Hello.
All right. Sorry about that. So today we have a day full of important conversations, rich conversations, and I'm more than excited to dive into our next topic. As Derek mentioned, this is our HS story, right? And so for those of you who don't know, hold on, let's get this iPad together. Many Black Americans are living with HS without even knowing it, often due to misdiagnosis, stigma, or lack of healthcare access. Today, we are joined by our incredible panelists of experts who will not only educate, but also empower our community with the information needed to recognize and manage and better advocate for those living with HS to receive better treatment. So let's go ahead and dive in. Ladies, first of all, I want to thank you so much for joining me today. So, Dr. Ghais, for those who may not be familiar, can you explain what hidradenitis suppurativa is and how it affects the body?
Absolutely. So hidradenitis suppurativa, we also call it HS because it's a very long name, is a chronic inflammatory skin condition, and it primarily leads to tender, painful nodules and abscesses. It can lead to progressive tunnels under the skin, and it primarily impacts the areas under the arms and the upper inner thigh and the groin and the buttocks. So very sensitive areas, very impactful condition. HS has one of the highest comorbidity burdens of any dermatological condition. So it's associated with higher rates of cardiovascular disease and diabetes, and it's very common. I mean, it impacts about 1% of the US population, which is over 3 million people. And to put that in context, that is about the same as the size of the population of Los Angeles or Chicago. So lots of people.
Wow. And so, as I mentioned earlier, it's often misdiagnosed, and you mentioned that it can be, these boils or these intense outbreaks on the skin. And so it's often mistaken for boils or acne or even, ingrown hairs. So what are some of those early signs that people should look out for, and how often does misdiagnosis actually happen in our community?
Yes, that is such a great question. And it's a huge problem with HS because we know that the average time to diagnosis is about 10 years, which is crazy. And so every misdiagnosis is really a missed opportunity for us to stop the suffering and to treat our patients and get them better. When it comes to the reasons why, I think it's a little bit of a few different things. On the one hand, a lot of providers struggle to diagnose HS and, in general. And then there's also an element of, with skin of color, you really want to focus on being able to appreciate the subtle signs of erythema and inflammation on melanin-rich skin. And so I think that there needs to be more education and awareness for both of those aspects to be able to properly diagnose and get patients the care they need. When it comes to the early signs, I really like to think about it as, typical lesions, typical locations, and the history of recurrence. So if you're getting these typical lesions in the areas under the arms and the upper inner thighs and have more than one in a 6-month period, that's really a sign that this could be HS.
Interesting. Charity, as we mentioned, many Black Americans struggle to get an HS diagnosis, and sometimes they wait years, as she mentioned, up to 10 years sometimes, which is a very long time. So in our community, there are barriers like lack of access or specialists in their area or insurance issues that play a big role in the lack of care. Can you talk about how these issues impact Black patients specifically?
Yeah, thank you so much. And before jumping into that, I just would like to introduce myself. My name is Charity Williams. I lead HS patient marketing, no worries, HS patient marketing at UCB. It's something I've become very passionate about. But to answer your question specifically, I think it goes back to some of the things that we've heard earlier, right? There is, while there's lack of insurance access and access from a financial standpoint, there's just a lack of access to specialists and education. And when I say education, I don't mean formal degrees or college degrees. We know there are still like high education rates within the Black community. However, there is a lack of education to go to a specialist. So I think many of us have probably experienced that. I think about my personal experience of going to a dermatologist once in my life because I have keloid skin and I had my ears pierced and had to get keloids removed. Never once has anyone else in my family gone to a dermatologist or had any reason to go. It's just not something that is commonly done as much in our community. And so it's the reality of like when you start having these boils, and this is a disease or condition that has a higher prevalence rate in women and a higher prevalence rate in the Black community. I think just for context, the Black community is infected at a 1.3 prevalence rate compared to 0.17 in other communities. So while they are not the majority sufferers of the disease, there's still a huge prevalence rate in our community. I say all that to say when we experience certain boils, especially women that may be in sensitive areas like your groin or your armpits, those are the first thing you probably do, especially at 12 or 13 years old, is go to your mom. And what we see often is that there is, oh, I've had these, it's a boil, put a hot rag on it. This is what I saw from my grandmother. There's just a lot of things that happen like that kind of keep us in this cycle of home remedies and things like that. So I say all that to say, by the time, with all of those barriers there to actually get to a dermatologist, the disease has progressed so much. And so there's just such an opportunity to really educate and empower this community that this is not just a boil. This is something that you have to find access for. And there's a lot of ways to do that are more accessible. Tono Health, and I know Dr. Ghais will probably mention that, as a great platform that focuses on skin of color, focuses on hidradenitis suppurativa, that actually can kind of help people who may not have access right directly in their community to see a dermatologist and things like that. So.
Yeah, absolutely. And I love that we're talking a lot about some of those outward facing symptoms, such as the boils and things like that. But I know we've talked personally about how I have a close friend who actually suffers from HS, severe HS. And over the past week, she's actually been in and out of the hospital dealing with intense pain. Some mornings she's not even able to put on her pants in the morning or pick up her 1-year-old daughter. So can we speak a little bit about some of those more severe cases of HS and what that looks like in our community?
Absolutely.
Either one.
Okay. I'm happy to share it. I'd love to, we can tag team it. But yeah, I think HS is a condition that affects everything. Like you said, there are outward symptoms of a physical boil. These boils, or they're boil-like abscesses that often bleed. They have an odor. They are incredibly painful. they itch. So it's not just like I've got this bump that I can kind of power through. But also many patients report feeling sick at the onset of a flare. There's all sorts of other things. And then it impacts everybody emotionally. Like you've got a boil in your stomach. I've heard of women not being able to pick up their child or breastfeed their newborn or even sit. We're all sitting in this meeting today. These chairs would likely not be comfortable for someone who has a boil on their groin, right? So there are just a lot of things that really impact more than just the physical that really transcend into the emotional and some of the mental health things that I know we'll discuss. But it is truly an all-encompassing condition.
Yeah. And the other thing I want to touch on is really that, the way that we treat HS and really the impact that we're able to have in the past 5 to 10 years has been so transformational. And so even though HS used to be a condition with very few options and patients felt very hopeless and probably less motivated to see a dermatologist because, then you go through this whole process of putting yourself out there, trying to seek care, only to be told that there's nothing they can do. And so the ability to really intervene at an earlier point and give patients back their life and give them back the opportunity to take care of their kids and to do all the things that they love, that's really been super incredible to see.
Absolutely. And so we know that HS is a very complex disease. Some say it's genetic, hormonal, or even linked to your diet. So can you break down how some of these factors interact, Dr. Ghais?
Yes, of course. And it's a great question. It's something we're consistently learning more about. We know that HS is multifactorial in that multiple things are playing a role in its pathogenesis. And so when it comes to genetics, 1 in 3 patients do report having a family member that also has HS. We know that inflammation plays a really big role, inflammation at the level of the hair follicle. And when it comes to hormonal or dietary impacts, that's where it becomes a lot more variable from person to person. Some people notice that their symptoms worsen after puberty or with hormonal fluctuations. But again, it's not really an all-encompassing thing. And there's a lot of research still being done to kind of figure out what exactly that role is.
Interesting. And so I know diet is a big conversation, especially in the Black community and some of the things that we choose to eat. So being that we are streaming live on the blackdoctor.org platform on Facebook, if there was anyone watching in or listening in, curious about how diet can impact their experience with HS, are there any particular foods that maybe they should avoid or maybe could heighten their symptoms? Do you have anything to share on that?
Yeah, absolutely. I think that with diet, again, it's one of those things where, similar to a lot of other chronic inflammatory conditions, it can play a role. It's not really a universal aspect that we can, tell every patient, if you avoid dairy, you will not have flares. But it is something where, for certain patients, it could be helpful in minimizing the risk of flares. So some of the, broad categories are dairy, very high sugar foods or processed foods. And again, really variable from person to person. I've also had patients that have cut out every single food and gone on these really intensive restrictive diets, and it didn't really help. So I think evaluating it as part of a comprehensive treatment plan makes a really big difference, and incorporating it, but not having it be the only thing that we're doing to intervene.
Absolutely. Thank you. Charity, as we've talked about, HS is a part of our community and impacts Black women heavily, but it isn't talked about enough, especially for those who are actually living with the condition. Can you share how stigma and lack of awareness impacts mental health as well as healthcare conditions in the Black community?
Yeah, thank you for that question. I think in talking about HS, this is a really important one because just talking about, let's just talk about the disease, right? Oftentimes flares can be brought on by stress. And so you are likely more stressed when you're not in a great financial situation, or you can't get to a doctor, or you can't maybe work because you can't sit for 8 hours a day at a desk, or you can't walk around because it's just incredibly uncomfortable, right? So when you think about just life and the stress that life puts on you, on any human, and then you think about that stress is probably increased for people of color and communities of color that have different levels of access to certain things, your condition kind of just, it's, you know, and it's not to say that Black people suffer greater, but I say that to say, like, there are certain elements of your conditions and your environment that probably do not help your disease, and it's just a harder cycle to get out of, I think, for the Black community, for one thing. I think, too, then you add the mental health stigma on top of that, and you know, now you're stressed all the time. You might be depressed. You might be suffering from other things that this condition has caused. And so you're probably, all these things are kind of exasperating the condition. And so I would say that it's been in the past 10 years or so where I think we've, in the Black community, had open conversations about mental health and going to a therapist and not just praying things away. Like, there is a space for both. And so I think that's something that we still have to really continue to work on, because I do believe that this condition is something that does require not just the physical care, but some of the other things that come with it. So I think the stigma is still there. I think, like you said, a lot of people do have this condition, and it is genetic. And so they are doing some of those home remedies that I talked about earlier, which is allowing the treatment to progress further, making it harder to treat later. So there's just a lot of things that I think are pervasive in the Black community, how we approach the healthcare system for various reasons that, you know, we can't completely, that are not our fault, but how we are forced to kind of approach the system makes it really challenging, makes it an even more challenging condition to treat. And I think there's still a lot that needs to be done, and just how we talk about it, talking about the condition, and then talking about some of the other effects of the condition as well.
Yeah, and I love, just to touch on that, what you mentioned about the increase or like decreasing stigma. Again, there's a ways to go, but the number of my patients that tell me that they are working with a therapist, and a therapist that really specializes in medical therapy. So focusing on patients that have a chronic disease and talking to them about how that condition is impacting their lives. Because when you think about HS, it impacts fairly young patients, and it's in very intimate areas. It can stay hidden for a really long time, but this is something that's really playing a role in their psychological development, their confidence, their ability to, have intimate relationships. And so how are we addressing both some of these hidden aspects as well as the medical management?
Absolutely. And, you know, I'm going to mention my friend quite a bit. She's the reason why I was so excited to do this panel. But even as we were, you know, just talking last week, she mentioned how she doesn't feel normal, right? And she actually received her first diagnosis, or had her most severe flare up, or her first severe flare up when she gave birth to her first child. And so imagine being diagnosed with a new condition that's impacting your skin, and then also having to deal with having a brand new baby. And so making sure that we address, you know, the mental impact of having a condition like that, and raising awareness in our community and making people more comfortable talking about it can completely change people's outcomes as well. And so to piggyback on that, what are some of the things that maybe family members or friends can do to help people or make them feel more comfortable in their skin? Either one of you, Charity or Dr. Ghais.
Yeah, I mean, I think that just really, coming at it from a place of compassion and understanding, and making people know that, this isn't something that they've caused. That I think all too often when patients even do go to a doctor or do seek care, that some of the things that, we know are completely inaccurate, but that patients are told if they're in the ER or, just in the health system, is that this is related to something with hygiene or diet, et cetera. And I think it's really important to emphasize that this is nothing that patients are causing. I mean, there's so many other elements that are playing a role, and it has nothing to do with hygiene. And to really emphasize that, that this impacts a lot of conditions, and kind of normalizing the aspects that this is something that we need to be talking about. And, I think there's been a lot of work done in the advocacy groups of kind of bringing HS into the spotlight and making it something that is more easy to discuss and less, hidden in the background. And that's made a huge impact as well.
Yeah, I completely agree. I think the first word that comes to mind for me is listen. These are individuals that by the time they come to you and a family member and say, hey, I've got this boil, or I've got this particular sensitive area, or I've got this particular abscess in a sensitive area, they have probably suffered through it a few times because it is incredibly shameful for them. So I ask that we listen to them as caregivers, as family members, but also as physicians. I think that's something that is incredibly important, as I've said before, and I think is kind of the thread of the conversation today. The way Black people approach the healthcare system is different. The treatment they get from their physician is different. So I really implore physicians to also listen. And if you don't know what to do, refer them to a dermatologist like Dr. Ghais, or a dermatologist that is equipped and specialized in treating HS, because it is a condition that even for the medical community is just now being trained on and just now being talked about. So I don't fault the physician community for not always approaching it immediately in the way that we know now. We know so much more now than we did a decade ago, but let's get that person into the right atmosphere to get the right treatment. But as a family member and as a community, I think let's listen and really believe what they're telling you, because once again, by the time they have come to you, they have been suffering for longer than you can imagine.
Yeah. And one last thing, I think one of the really beautiful aspects has been seeing patients, younger patients coming in with their moms because their mom had HS too, but back then there weren't really any effective treatments. But, after seeing and hearing about all of the different options now, the moment it started for her daughter, she's like, we're going to a dermatologist, we're getting ahead of this and treating it more proactively instead of just, having to wait for things to get really severe in order to act.
Absolutely. I love that you mentioned that a lot of the younger girls are starting to bring it to the spotlight in your first response. I've seen some influencers on social media. The PCOS girls are out there. The HS girls are bringing those conditions to the forefront. So I absolutely love seeing that. Unfortunately, we're running low on time, and I want to thank you ladies so much for joining me on the panel. Before we close out, I do want to ask one question, hopefully for those who are listening who maybe suspect that they have HS and are wondering where to start. What is the first thing that they should do?
I would say that, they should get care from a board certified dermatologist, and preferably someone who specializes in HS, because there are incredible treatments and we know they're effective. I see it every day, and they're very targeted. And so if you can get ahead of that and to prevent this irreversible damage, that should be the first thing.
Yeah, I completely agree. Getting to a dermatologist is incredibly important. And now more than ever, I'll steal the words of Brinley Brooks, who is a leader, an advocacy leader in the HS community. And she says there's never a good time to have HS, but there's also never been a better time to have HS, because there are more resources now than ever in terms of treatments, but also in terms of resources and how do you get to a dermatologist. So I'd love to just share makehistory.com, which is a physician and patient resource that you can actually find more information about managing and finding that right dermatologist. And then there's also advocacy groups like HS Connect. There's so many things. There's I know you're a part of Tono Health, which we mentioned earlier, but there's so many opportunities to learn and learn in a way that you're getting accurate information. So I really implore you to do that. The HS Foundation is another incredible place to, they actually have a map, I believe, on there that helps you identify where a specialist is, a dermatologist that specializes in HS is close to you. MakeHistory.com does as well. So once again, just really implore you to not be ashamed and get the right treatment and kind of start taking those steps.
Absolutely. And just to chime in, blackdoctor.org as well has an HS channel dedicated to the patient journey living with HS. So again, ladies, I want to thank you so much for joining me on the panel. Can we please give them a round of applause?
Thank you, everyone.
Thank you all so much.